Let's get more now with John Ransom, Managing Director and Director of Healthcare Research at Raymond James. John, great to have you with us. You say that, the healthcare industry has always been unpopular, that UnitedHealthcare in particular has worked through these periods in the past. But wouldn't you say that this is a little bit different? I mean, we haven't been through a period where the CEO of a healthcare unit gets assassinated in the streets of Manhattan and people are cheering.
Sure. I mean, the old saying that politics is downstream of culture. The culture right now would paint these a bullseye on these guys, to use a bad metaphor. I think the uncertainty, if you look at the Gallup polls, it's gotten more unpopular among Republicans. If you look at the polling, it's kind of fascinating. So we don't know who's going to be occupying these seats next year in Congress. But this industry, particularly the Medicare Advantage guys, were beat up pretty badly by the Biden administration. Investors think the incoming Trump administration will be a little kinder. But I think the bet is a little bit hard to make because you don't know who's going to be occupying these seats. And also, you do have a more populist party, and the industry is not as popular as it used to be.
Yeah. What is the biggest risk to this industry? I mean, part of it is the lack of transparency. So to the extent that there could be forced transparency in the form of some sort of regulation, would publishing denial rates be that detrimental to the industry? I mean, as you sort of take a look at the risks, what are those risks in your view?
Well, what's interesting, let's take CVS. You had an eloquent money manager on a couple of weeks ago. CVS's medical loss ratio in their Medicare Advantage book is up from about 85% to over 95%. So CVS is actually spending 10 points more, and they're losing their shirt. They're losing billions of dollars in Medicare Advantage. So if you look at the business risk, it's the fact that medical costs have exploded. Now, of course, that hasn't bought the industry any goodwill, but the truth is these insurance companies that people don't like are losing their shirts on Medicare Advantage, and also on some, CVS also is losing $1 billion in the exchanges. So the risk is that's the risk. It's the medical loss ratio. I think the legislative risk, and this is where I think there's a debate, is have we overused AI for things like prior authorization? Could we do things to make appeals processes more transparent? Could companies be easier to work with? Absolutely. And that's the thing, I think, where there could be some meeting of the minds. I mean, when you get a claim denied, I can't think of anybody who's come away from that saying, oh, gosh, when I appealed, that was just a wonderful process. And I think, lastly, like AMA is on this warpath on prior authorization for prescriptions. And that used to be in place for very expensive drugs. But again, this trend has increased. Prior authorization has grown and grown. I talked to a guy yesterday, he said, yeah, every one of my prescriptions is prior auth and has to be appealed. So I think that friction and maybe the overuse of AI, United bought a company called UnitedHealth, and I think replaced some of the human engineering with some robotic engineering. And that's where I think there should be a healthy debate, because maybe that has gotten out of control.
So there is an aspect of AI gone wrong. I mean, investors are touting AI as a great growth trade, right, on one side of the ledger in the markets. And then here we are in an example of an industry that has embraced AI. In theory, it should reduce costs tremendously because of all the paperwork. And yet it's backfired in this case. Do you think the companies are willing to roll back?
Let's think about good AI. Let's say I'm a United customer, and they look at I got discharged from the ER for 2 a.m. I missed a prescription. I've got a police record. I've got something on my file. They should say, let's get John some help. Predictive analytics, get John some help. That's using large language models to look across all these data sets, predict where people need help, intervene before they crash. That's a great example of where AI should be. But did we overdo it on prior auth? That's the debate. I'm not saying we did, but I think that's where we need to have a debate.